Good morning, everybody. My name is Joe Conzo, and first of all, I want to welcome you to the EMS FDNY Help Fund uh, celebration of EMS Week. And real quickly, EMS Appreciation Week started 46 years ago, and it's a week dedicated to EMS across the country, to all the EMTs and paramedics that basically put their lives on the line and every day. And so happy EMS week to everybody out there. And I just want to tell everybody, if you see an EMT or paramedic in an ambulance, wave at them. They love getting waved to, and tell them thank you. Thank you. So, we're going to talk about, EMS, and we're going to talk about, what comprises of the EMS system. EMS stands for Emergency Medical System, and EMS is part of the New York City Fire Department. The fire department has firefighters, EMTs, paramedics, fire inspectors, fire marshals, and a whole slew of other people working under the fire department umbrella. So, as an EMT, which stands for Emergency Medical Technician, I worked for the fire department for over 25 years. And I came on the job in the early 90s, and things were a lot different then. There were only, I say, about 2,500 EMTs and paramedics working at the time, compared to today, where we have over 4,500 EMTs and paramedics working today, answering 911 calls. And those we answer about 1 million.5 911 calls a year. And on those, when you call 911, you'll either get an EMT, paramedic, and or a fire department engine truck with CFRD personnel. And CFRD stands for Certified First Responders. So we have some firefighters out there that respond to medical emergencies when you call 911. So real briefly about me, I joined EMS because I love helping people. One of my first jobs out of high school, I worked at Lincoln Hospital in the Bronx in the emergency room as an ER tech. And I used to see these guys in these green and white uniforms come in and out of the emergency room bringing patients. And it was like so cool. It was so cool seeing these guys helping people, just the same way as doctors and nurses help patients when they walk into the emergency room. But these guys, these EMTs and paramedics, were on an ambulance that brought that emergency room to your house. And I was like, wow, that is so cool. I want to do that. And that began my career. So from Lincoln Hospital, I went to the Army. I became a combat medic and an EMT. And when I got out the Army 3 years later, almost 4 years later, I joined the New York City Fire Department slash HHC at the time and became an EMT. Now, in those days, it was really different. We didn't have that much equipment, that much training, but you were an EMT. And to become an EMT, you had to go to school to get your certification. I did it through the Army and LaGuardia Community College when I got out the Army. But it's a 6 months course to get a state certification from the Department of Health, and you become an EMT. Then you apply to work for the fire department. To become a paramedic, you first have to be an EMT. And then after you become an EMT, you go on to paramedic school. And we'll get into that later on about the difference between the EMT and paramedic. But I just loved the job that I was doing. I mean, I got to meet so many different people all across the Bronx. I worked mainly the Bronx at the time, but different areas, Manhattan, Queen. And it was such a rewarding job. There's nothing like using your training as an EMT to basically save somebody's life. And that's what we do day in and day out. And it's such a rewarding feeling. When I tell people what I did for a living, I tell people that I saved lives and I delivered babies for a living. And they look at me and it's like, wow, that must be such a cool, fun job. And it was. And it was. And I miss it terribly. I've been retired for 2 years now, but I still stay in touch with with my coworkers and help out as much as I can. And that's why I'm here today talking about EMS. Um, the difference between an EMT and paramedic is basically education. Okay, an EMT can do what we call BLS work, basic life support work, and now we can give oxygen. We can shock your heart when you're having a heart attack. We can do a lot of things like that. We can bandage up your arm when you're bleeding, and so many other different things. A paramedic who has those same skills goes on to learn more skills and give more medications. And that's between an EMT and paramedic. So when you're an EMT, you work under what's called the BLS, basic life support. And then when you're a paramedic, you're advanced life support, ALS. So those two combined, we respond to these 911 calls. And when you call 911, and each and every one of you should know how to call 911, you call them for emergencies. Okay. And the first thing you want to do is, if there's an emergency going on in your house, is A, remain calm. You want to see if there's any other adults in the house to let them know that there's something going on. And if there aren't any other adults in the house, you need to call 911. But what you need to know is your home address and your phone number and what's going on. Because when you call 911, you're going to get an EMT or paramedic on the other line, uh, uh, a 911 operator who's going to ask you a series of questions, and you have to be able to answer those questions the best of your ability. But basically, you need to know what's going on to the best of your ability and what's happening. And in certain cases, they might ask you to do certain things. So, like, God forbid an adult in your house has become unconscious, they're going to help you see if you can wake that person up. Okay, they're going to tell you to do certain things, and you're going to try, and then they're going to tell you to, and the ambulance is on the way, make sure the door's open to let them in. Okay, so don't be afraid to call 911. It's really important. It's really important that you know your home phone number and your address to where you live. Okay. So, I want all you guys to go out there. You're not too young or too old to know this, but if there is an emergency, you can call 911 and you can get an EMT or paramedic to come and help with the situation. Now, there's different types of emergencies. There's what we call medical emergencies and trauma emergencies, injuries. Okay. And there's different things that we do. If you're having a medical emergency, like if your heart stops, we'll bring you to a hospital and we'll perform certain things that to help you get your heart start again. If you have an injury, a broken leg or something bleeding, we'll put a bandage on or a splint and try and help control that situation. Now we have specialty hospitals. We try and bring all patients to the closest hospital in where you live at, but in some cases that really doesn't help. So we bring you to these specialty hospitals. So we have this one hospital in the Bronx called Jacoby Hospital that if you, God forbid, were in a fire and had a lot of smoke inhalation in your lungs, we would bring you to Jacoby Hospital where they have this huge machine and it's called a hyperbaric chamber. And that chamber just pumps your lungs with pure oxygen and gets you all better so you can go home. Another situation is like if you get your pinky falls falls off because it got slammed in a door or something like that, we would bring you to a hospital like Montefiore Hospital in the Bronx, which is described as a reimplantation center. And all that means is that they'll just sew your pinky back on. So, EMS, we're trained to do so many different things. And the city has so many different hospitals to adapt to all these different medical emergencies and injuries. We have hospitals deal that are called trauma hospitals. God forbid, you're in a car accident, you would go to a trauma hospital and things of that nature. So it's good things to know, but the most important thing is to know how to activate the 911 system. And that is by calling 911 when something happens and you need to help somebody. My career has been rewarding. I've traveled the world visiting different people and different EMS systems, and I'm so grateful to that. And it's been a rewarding job, and I miss it terribly. So it's a good job where if any one of yous out there want to become an EMT and paramedic, by all means, come on, do it. Go to school, get your certification, become an EMT or paramedic, and it's a great job. You'll always have a job in the medical field. Always remember that. And then you could always go on to do other things. So many of my coworkers who were EMTs and paramedics have become nurses and doctors and surgeons. And it's just a great pathway to a medical career. And, it's just a lovely career. I've been so blessed to have done it. And I'm so grateful. Um, let's get into some questions that we have out there that you guys sent in. So we're going to go to question number one. And that's question number one. And that's from Aaron from the fifth grade from PS 267 Bay Ridge School of the Arts. And his question is it scary to be around the virus because you don't know who around you might have it? Yes, it is scary. Fortunately, and I say that, no, let me rephrase that. Unfortunately, I haven't had to deal with what's going on today since I've been retired. And it breaks my heart that I'm not out there helping, but I'm helping out in different ways. But in my career as an EMT, we have dealt with other pandemics that we're dealing with today. Not on the scale that we see today, but we've had pandemics like the Ebola pandemic a few years ago, right after 9/11. We had the H1N1 flu pandemic. So there were certain things that we dealt with and we trained for. And yes, it is scary. You don't know who has it, who doesn't have it, but that's why we wear our gloves, our face shields, and our PPE gear. Okay, and that's how we deal with those situations because we have to be healthy as EMTs and paramedics to provide you with a safe surrounding so we can make you better. Okay. So, an EMT or paramedic that is sick can't help somebody else that's sick. So we have to stay healthy and we have to protect ourselves and wear all this gear and stuff. But yeah, it can be scary, but with the amount of training that the EMTs and paramedics do, and every year there's more and more training, we become confident in our training to deal with situations like that. So, yes, Aaron, and that's a great question. So, we're going to go on to question number two. And that question is from Nathan. Nathan is in the fourth grade. He's from PS 88 Seneca Ridgewood. And he's asking me, what is the difference between an EMT and paramedic, and what is rewarding for you? Well, like I said earlier, the difference between an EMT, an emergency medical technician, and a paramedic is training, basically training. You can't become a paramedic unless you're an EMT. Um, an EMT can perform certain life saving skills, and a paramedic can perform more life saving skills. In essence, they can give more medication than an EMT can. And it's a lot more, it's about, I say, another 9 months worth of more of training than a basic EMT training. But we work together. And that's the beautiful thing about EMS, the emergency medical system. You have these two great peoples working together to save lives every day out on the front line. So, that is the difference between EMT and paramedic. And it's very rewarding for me. I love the fact that I'm able to help people. I've had many occasions where I've taken people to the hospital and run into them later on and say, "Thank you, Joe. You saved my mother. You saved my father. Um, the baby I delivered is named Joseph Anthony after you because you've done such a wonderful job. And that to me is rewarding. Saving somebody's life to me is priceless. You can't put anything, a price on that. And that to me is priceless and very rewarding. Question number three, Joshua, first grade, PS 92Q, Harry T. Stewart, senior school. How did you become an EMT and why did you want to become an EMT? Well, Joshua, like I said, when I first graduated from high school, I got a job working at Lincoln Hospital in the Bronx in the emergency room as a ER tech. And basically, as an ER tech, I admitted people to the hospital and helped the doctors and nurses with blood work and stuff like that. But seeing these giants, you know, come into the emergency room with patients and these EMTs and paramedics just drew me to what they were doing. And I'll never forget, there's one time where I saw an EMT run into the hospital emergency room with a baby in his hand, giving him mouth to mouth, resuscitation. And that to me was just so awesome. Seeing this EMT breathe life into this baby and the baby live. And that's what I wanted to do. And that's why I became an EMT. And it's been my career for over 27 years. And that to me more rewarding than anything else that that somebody can do. I'm very biased, you know, love you doctors, love you nurses, love you firefighters, love you, police officers, but not too many people say that their job every day, 7 days a week, 24 hours a day, 364 days a year is to save lives because that's basically what we do. And on a typical day for an EMT and paramedic is that we show up to our EMS station, we put on our uniform, we get our ambulance, we get our equipment, and we respond to our calls. When you guys call 911 and you live in my area, my ambulance would respond to your call and we would take you to the hospital. But before we would take you to the hospital, we would do what we need to do to help alleviate and get you better. Next question, question number four. And this is from Christian. Christian is in the fifth grade at Challenge Preparatory Charter School. What is the main difference in medical calls now compared to when you first started 27 years ago? Well, things change over 27 years. Training comes in, and there's so many things that have changed. When I first came on 27 years ago as an EMT, basically all I had was just a stethoscope and what we call a tech bag. And in that tech bag, we had band-aids, gauze, ambu bag, and that's a bag that we use to help people breathe, and basic stuff. Today, things have changed so much. I have what's called PPE gear. That's another set of uniform that I put in to protect me from fires and germs and things of that nature. I have what's called a defibrillator, and it's that little box that you see on TV that they put on your chest and shock your heart. I have another piece of equipment. It's called a suction unit, where I can suction, fluids from inside of you. I even wear a bulletproof vest. That is crazy. So things have changed in the past 27 years. And yes, the training has changed. Um, Today, EMTs and paramedics are trained to deal with, hazmat situations, biochemical situations, all types of situations. And, when I first came on, it was a little bit crazy back then, and since then, since 9/11, my ambulance was one of the first ambulances down in 9/11. Up until that point, we never spoke about terrorism. and now we speak about terrorism. So we got training for that. So the training has changed, Christian, over the years. The equipment has changed, and we adapt. Things have happened since this crisis that's going on now, and we're going to adapt and we're going to move forward. So we're going to go to the last question, and that's question number 5, and that is from Olivia. Olivia is in the 4th grade from PS 133 in Queens. And her question is, do you get anxious when you work with people who have COVID-19 or different illnesses? Well, Olivia, yes, but it's okay to be anxious, okay? Because when you're anxious, you're aware of what's going on. But again, like I said earlier, you have to remain calm. You're no good to anybody if you're anxious and nervous. Okay? If you're anxious and nervous, you won't be able to call 911. If you're anxious and nervous, you won't be able to perform the things that you trained for when dealing with patients. But it's okay. It is okay. We have a saying in EMS, to be aware is to be alive. So you have to be aware of your surroundings. We have what's called scene safety first. I need to worry about my safety and my coworker and my partner's safety before I can do anything else, because an EMT or paramedic that's in danger or not aware of their surroundings is no good to anybody. So yes, you do get a little anxious, and you deal with it and you move on, because the reward out of all it is helping people. And that's why we're doing what we're doing today, and live streaming and talking about EMS, the emergency medical system, and paying tribute and homage to all the EMTs and paramedics across the nation and across the world. So again, I want to say thank you to the EMS FDNY Help Fund. For all the parents out there watching, please don't hesitate to click on a link or look us up and make a small donation. For all you boys and girls out there, please make some signs and say thank you, FDNY, EMS. Hang them in your window, hang them in your cars, and just say thank you. And you know, thank you for doing what you guys do and supporting what we do. And please, 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 please stay safe out there, be aware of your surroundings. And, when you go outside, if you have to wear a mask, wear a mask. If you have to wear gloves. And I promise you, I promise you, I promise you, this too shall pass. We're going to be fine. Take care of your parents as they have taken care of you. And God bless everybody, and be safe.